Rebuilding Together. That's the new tagline for Doctors Hospital Rehabilitation Program. The Doctors Hospital Rehabilitation Center is celebrating National Rehabilitation Awareness Week. Today, members of the rehab team are going to join me to talk about the benefits and impact of rehabilitation therapy. Keep watching. This is You and Your Money.
You and Your Money is brought to you by Doctors Hospital Health System.
Welcome to You and Your Money, everyone. Daniel Douglas is a physiotherapist at Doctors Hospital. In recognition of National Rehabilitation Awareness Week, he is here to bring awareness to the benefits of physical therapy, which is part of the rehabilitation services at Doctors Hospital. Welcome to the show, Daniel.
Thanks for having me.
Now, Daniel, talk to us about what it is that you actually do as a physiotherapist and some of the conditions physical therapy helps with.
Okay, so in terms of physiotherapy, we are a group of non-invasive professionals, i.e. we don't do surgery or administer medications and things like that. And our primary role and function and focus is to restore maximum movement. So we're essentially movement specialists. So we intend to restore, maximize, prevent, and treat any type of disability or inability to move and function that one might acquire due to injury or some other sickness. In a general sense, we kind of break up our services into different areas. So we would have musculoskeletal, for example, which would be anything skin, muscles, bones, ligaments, tendons. So you can have tears, strains, broken bones, herniated discs, you name it. Anything with your skin and bones and muscles, you have an injury there, we can help rehabilitate with that. In terms of cardiopulmonary, heart and lungs, so pneumonia, or if you have any cardiac conditions, there's usually a program and a specialist to be able to assist you with that. And lastly, the big one, the neurological domain, which would be anything brain and spinal cord. So strokes, any type of neurological injury in that regard. Head injuries or spinal cord injuries, like in a car crash or anything traumatic, and might leave one paralyzed or otherwise not able to fulfill their full function. We would be there to assist you in recovering and getting back up to speed and back to your full function.
You talked about you being a movement specialist. Now, as a movement specialist, what are some of those treatment methods that you used in physical therapy?
Well, there's a lot. So you can start with some, in terms of pain management, we have what we call pain modalities. So we can use heat, we can use cold, we have ultrasound, we have electrical stimulation, varying modes of that to assist you in getting back into function, range of motion, pain control and modulation, different things like that. There's more manual hands-on therapies, which we can do joint mobilization, so like just moving little bony segments and giving you micro stretches. Actual exercise, which in our domain, exercise is really our mainstay of medicine. And then there's a whole host and a large variety of what we do with that regard. So definitely quite a few things.
And thinking about exercise, I mean, oh my gosh, it's almost as though you gotta get up and get moving, and that's the whole idea behind the whole therapy. Now, for those viewers that may be wondering, is there a difference between physical therapy and physiotherapy?
Oh, absolutely not. It's exactly the same thing. It's just a synonym and it's used interchangeably. It's exactly the same thing. Physical therapy and physiotherapy, same thing.
Considering the alternatives then, though, of the physical treatment or the physical aspects, why should one choose physical therapy?
Well, physiotherapy is definitely a mainstay. It's something that you definitely want to attack firsthand because you're going to come in, you're going to get a full assessment, and we're going to take into account all the different factors that would affect you, the physical factors, the mental factors, relational, social, professional, to create a large profile of who you are as a person, and then we treat that. And we target all the different discrepancies, and education is the mainstay of all the treatments that we have. So of all the different things that we can do, the most powerful tool that we use for treatment is education. You're going to get educated from the first second you enter and the last second when you're discharged and leave.
Yeah, it's interesting that you talked about the educational component and how you take into consideration so many aspects of an individual's life. When we think about the studies, it shows that 20% of the patients, they actually drop out of therapy within the first 3 visits. And up to 70% of them actually fail to complete their entire course of care. Why do you think the attrition rate is so high?
It actually would be so high for a few reasons, but the main reason why it's so high, it happens because when expectation very quickly meets reality. So when there are certain medical services or certain services you go to and it's a one-stop shop, you pass through, you do a quick procedure, you do a quick maneuver, and then you have almost instant relief. So there's an expectation that you're just going to walk into a physiotherapy office, you're just going to do that one session and you're going to have that instant relief. And it's funny that you mentioned 3 sessions because usually that's kind of that pain maintenance threshold region that we work in. So we try to reduce pain as much in that area. So it's a lot of work. You're going to have an initial evaluation and we're going to try to stimulate some of those symptoms to find out exactly where the issue is and what exactly we need to do. So we're going to give just a little bit of pain, if I'm being honest here. So when that expectation is not managed and goals are not set and given to the patient and you don't have that back and forth banter as to what to expect and what's going to happen, you're going to have that issue. Secondly, there's a financial barrier that tends to come up. All healthcare services are expensive and they're also unexpected. So you try your best to mitigate that cost and you work with the patient, and we are always pro-patient. Patient always comes first. So we would do whatever it takes within legal ramifications to get you what you need to get. And then there's a mental aspect to pain. So when you're chronically ill and have pain for months to years, it affects you mentally on a certain level. Your ability to, your desire to want to function, everything about you is just changed and just kind of numb and very low. So your stickability, so to speak, is very low. So just being able to talk to that patient, find out about different things, modify their activities to maximize their function. And lastly, just another point is job. So job is a big reason. So persons have jobs that require heavy lifting and a lot of movement and a lot of standing or a lot of walking or even running and jumping. And when you come to me and I tell you, you can't do any of those activities, or at least 80% of it has to be cut out for about 3 to 6 weeks, it's a problem. Persons are immediately scared and they worry about losing their jobs. So we come in now and we find a compromise. Every day is a compromise in physiotherapy. No day is flat out, and as it is, it's a compromise. And you find that ground where I can get what I want and you can get what you want. And then everybody's happy. So it's about being proactive and thinking about these barriers before they appear and just kind of attacking them and eliminating them from the start. So that is something that would definitely decrease those high attrition rates.
Daniel, I like how you say every day is a compromise. So if you're thinking about physiotherapy, make sure you keep that in mind. Thank you so much for coming on the show today, Daniel.
Thanks for having me so much.
Awesome. So coming up next, 2 of Daniel's colleagues will be joining me to talk about the benefits of occupational therapy and speech language pathology. You're watching You and Your Money. We'll be right back.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Doctors Hospital's pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now.
Go to doctors.
3 advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Money. If you're just now tuning in, members of the Doctors Hospital Rehab team are here today in recognition of National Rehabilitation Awareness Week. Before the break, I spoke with physiotherapist Daniel Douglas. Joining us now are occupational therapist and manager of the Rehabilitation Department, Zenobia Neely, and speech-language pathologist, Krista Major. Zenobia and Krista, welcome to the show.
Thank you. It's good to be here.
Now, Zenobia, what is occupational therapy?
So occupational therapy is a healthcare profession that focuses on function. Unlike other areas of rehab, our premise is really based on an individual following an injury or condition or an illness, resuming all of those occupations they would have once done prior to their injury.
You talked about function and help us to understand. The Doctors Hospital Rehabilitation Center offers pediatric occupational therapy. Now, what are some signs that a child may actually need pediatric occupational therapy?
So whenever a child does not or is not displaying the skill set, or they appear not to be meeting the developmental milestones as they should, that's a clear indication that they probably should be seeing an occupational therapist. So these skill sets might look like handwriting skills, if they're dressing themselves independently, if they're feeding themselves, anything that a child should be doing at a particular age and they are not actually performing it optimally, that can be an indication where that child might need to see an OT. But first and foremost, you should see your pediatrician who will assess the child fully, and then, if needed, will write a referral for the child to receive services.
Now, based on what it is that you said, it says to many parents or parents out there to be very aware of what it is that's actually happening with the child and how it is that they're actually developing. Now, Krista, as a speech-language pathologist, you also work with kids as well as adults. What are some signs that a child may benefit from speech-language pathology?
If your child has reached 12 months or older and they're unable to express their wants and needs using simple one-word phrases or responses, they're not able to say mommy, daddy, I want, they may not be able to request for juice or any other food items or things that they enjoy. These are some concerns that you would need to bring to your pediatrician. The child may not be able to express themselves verbally. They may just be able to point to items that they have interest to. And these are things that you should, like I mentioned, you should return to your pediatrician and express those concerns. They would most likely write a referral. That referral is brought to a speech-language pathologist where they would be evaluated and assessed.
I know that working with kids can be a vast difference from working with adults. So, Krista, tell us about your approach. How does your approach to treatment differ when working with adults?
Working with adults in the rehab setting, Most adults might have had a stroke or a traumatic brain injury, so they may have difficulties expressing themselves verbally or using their language skills. They may not be able to follow simple directions. So these are areas that a speech language pathologist would work on. They may not be able to swallow solid foods or liquids like they once had prior to their stroke. So these are areas that we would work on.
Zenobia, what are some occupational therapy treatments that are used to help the elderly, particularly those with dementia or Alzheimer's, become more independent?
Okay, so just for clarification, dementia is an umbrella term that's associated with deterioration of brain functions. So for example, the way that we process information, the way that we communicate, and the way that we recall information. And Alzheimer's is just a type or a form of dementia. And so OTs would address deficits or issues in those areas with the patient as well as with their caregivers. And depending on the stage of dementia, the patient is demonstrating that there are a variety of interventions that OTs can use with these types of patients. So, for example, in the early stage of dementia, we might need to use more visual aids and reminders, cues, such as writing in a journal or maybe alarms, calendars to remind you of appointments. And as the disease progresses, you might need to work a little bit more with retraining of self-care skills. So bathing and dressing, light or simple meal preparation. A lot of our intervention also involves educating the caregiver and family members as well of how to appropriately manage patients that have dementia. And that might also involve proper positioning to avoid breakdown of the skin, home exercises so that we can prevent contractures or stiffness of the joints, and just basically optimize and improve the quality of life of our loved one.
The role of a caregiver is one that's definitely not even talked about that often. And I think it's so important when you look at having to properly care for our loved ones, like you said. Now, Krista, can speech language pathology be used to help adults with dementia and Alzheimer's as well?
Yes. As a speech language pathologist, we would work on certain areas, for example, memory exercises. In terms of patients that may have lost their ability to swallow due to dementia, Alzheimer's, they may have weakness in their oral motor skills, so they may have difficulties orally producing speech.
I mean, I don't think I would have thought about there being the moment in time where you have a difficulty with swallowing and some of the things that will actually come about or may actually be the thing that actually causes it. Well, I think you've taken me through a whole lot in terms of speech pathology and what it is that you guys actually do. So Zenobia and Krista, we've got to take this quick break, but we have more to discuss when we get back. This is You and Your Money. We'll be right back.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Doctors Hospital's pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. Three advanced facilities at Collins Avenue, Carmichael Road in Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Money. We're continuing our conversation on the benefits and impact of rehabilitation therapy. Still with us is occupational therapist and manager of the rehab department, Zenobia Neely, and speech-language pathologist, Krista Major. Now, Zenobia, statistics show that 1 in 4 adults over the age of 25 will have a stroke in their lifetime. How does occupational therapy help stroke patients during the recovery process?
Okay, so again, a stroke is a neurological deficit that can affect function and performance of daily functions in a very significant way. So you might be affected in terms of your ability to perform your self-care skills once again, just getting up and out of the bed in the morning, taking a shower, driving, caring for your loved ones. So if you have small children, being able to lift them and change their clothes and just fulfill all of your parenting duties and all of your duties for your contractual job. And so an OT would come in there and assess your deficit, but not just your deficits, but your strengths as well, and then integrate all of those wonderful interventions that's going to maximize your quality of life, that's going to help you resume some of those activities. And at times it might be in a very adaptive way, so you might be required to use adaptive equipment. It might call for modification of the environment. Also, it might just be a lot of hardcore time with focus on exercises and regaining all of those motor and sensory skills that you would have lost as a result of the stroke.
When you think about stroke, oftentimes persons may actually lean more into the deficit side of things, but you actually spoke about having to look at the strengths, and I think it's important that we continue to have that approach as we're looking at how we help people in terms of their recovery process. Krista, what is your role as a speech-language pathologist in stroke recovery?
As a speech-language pathologist, depending on the severity of the stroke, some patients may have difficulties expressing their wants and needs verbally or even non-verbally, so they may not understand language. So they may have difficulties being able to, like I mentioned, verbally express themselves. They may have to use other forms of communication. What we use usually are communication boards, picture communication books. This is used for helping and assisting patients that may have had a stroke, kind of regaining some of that independence and being able to just require and assist their family members with expressing the simple things that they may want. Do they want something to eat? Are they in pain? Are they tired? Also, like I mentioned, depending on the severity, again, they may not be able to safely swallow certain food and diet textures, so they may have to be placed on a modified diet. With this, they may have to be placed on a feeding tube. So it really depends, like I mentioned, on the severity.
When you think about having to monitor dealing with the speech component as well as having to deal with some of the creative ways, and having to help these persons who may have suffered from strokes, we do appreciate and understand that the family has to be involved. So in both occupational therapy and speech language pathology, are family members trained to continue treatment in between sessions? Krista, I'll start with you.
Yes, we definitely encourage that family members work on exercises that we've trained them to perform in session They're also asked to work on these exercises at home in the patient's least restricted environment where they're more comfortable. So after each session, we do give homework or handouts, just materials that we would recommend that they continue to work on at home. We tell them how each exercise is performed, and we expect that they are continuing to work on these exercises so you could really see the benefits of therapy. It's not only performing these exercises in treatment, but also being able to use it in your everyday life.
Okay, Zenobia, how about in occupational therapy?
So as Krista so ably explained, the caregiver role is vital in the recovery and the rehabilitation of any patient sustaining an injury. I like to tell my patients, I'm just somewhat of a tour guide. I'm just here to give you instructions, but our session may only last an hour. There are 24 hours in a day, so it's what you do outside of the clinic that's really going to make the greatest impact. So our caregivers, we do depend on them heavily to reinforce all of the skills, all of the training that we would impart to our patients.
For the caregiver that's actually out there and they're just wondering, how does one start the process of having to get access to the services at Doctors Hospital Rehabilitation Center, and what is the cost, Zenobia?
So Doctors Hospital Rehabilitation Center is a referral-based healthcare facility. So this will involve you having to see your physician so that your physician can properly assess you and diagnose your condition. Also set any precautions that need to be set so that we will know as a guideline how to treat you most appropriately. Once you would have retrieved your referral, you are going to give us a call at any one of our two locations, at the Cable Beach Shopping Plaza and at number 9 Collins Avenue. And there, the admin assist will so ably verify your benefits, make your appointment, and then we will see you for OT, PT, or speech language pathology.
You said a key word there, benefits. Are rehabilitation services at Doctors Hospital covered by insurance?
The answer is yes. Occupational therapy, physical therapy, and speech language pathology are all covered by insurance. And currently, this is the best time to actually come and get rehab services because we have a number of promotions going on right now. First of all, we have our LAMP program. It's a loyalty program that allows you discounts on rehab services, but services across the healthcare system. Also at this time, co-payments are being waived for insured patients. Additionally, there are bundled or packaged discounted rates for patients that require more than 2 services. So if you require maybe speech and occupational therapy, or speech, occupational therapy, and physical therapy, and you are a self-pay patient, we have discounted cash rates for you as well.
Krista, how long are the sessions, and can they take place at the patient's home, or does the patient have to come to the rehab center?
Sessions normally range anywhere between 30 to 60 minutes. And we do offer home care therapy sessions. So patients are able to receive treatment sessions in their home. So you don't have to come to the rehab center for all of your sessions. If you are a home care patient, we would come to you.
Zenobia and Krista, thank you so much for joining me on the show today.
It has been a pleasure.
Thank you for having us.
To learn more about Doctors Hospital's rehabilitation program, visit doctorshosp.com/rehabilitation or call the Rehabilitation Center, which is located on Collins Avenue at 302-4636. I'm Ria Christina. Don't forget to follow You and Your Money on Facebook and tune in next week for a brand new episode. Thanks for watching.